Welcome to today's episode of Dr. Ozello's Sports Medicine Report. The topic for today is osteoarthritis. Yes, you heard me right, osteoarthritis. Osteoarthritis is one of the most common forms of disability in the entire world. Of all the topics that I've talked about, it is the most prevalent of any of those conditions. It happens to almost all of us at some point in our lives. It is the most common form of arthritis. It is one of the number one reasons that people cease doing a certain exercise or a certain sport. Any type of weight-bearing activity such as running, jumping, hiking, climbing are definitely affected if there is a case of osteoarthritis in the knee and in the hip. Now, I'm going to mostly concentrate today on osteoarthritis in the knee and in the hip because those are two of the most common areas that this condition occurs in. Osteoarthritis can be debilitating. It is a late onset progressive degenerative disorder. It is also called degenerative joint disease. It's very common among athletes and non-athletes. The athletes can be athletes of any sport. It doesn't matter what sport that it is. Osteoarthritis is more prevalent in athletes than in non-athletes of the same age later in life. It is also more prevalent in athletes if they have had a traumatic injury to that area or if they have had repetitive trauma to that area. If you are an athlete, even if you're not an athlete, you still want to educate yourself on the causes of osteoarthritis, on the symptoms of osteoarthritis, on the preventative measures, and on any strategies that you have to continue to exercise and continue to compete if you do have symptoms of osteoarthritis should this condition begin to occur. The anatomy of a joint is quite complex, but I wanted to go over some of the basics so you understand exactly what is going on in osteoarthritis. One of the things I want to talk about is called the articular cartilage. The articular cartilage is a thin, specialized connective tissue that is on the end of bones. It covers the end of the bones where the bones come together to form a joint. It has a couple different functions to it. First of all, it helps provide a smooth, lubricated surface, and it also helps in the facilitation of the transmission of loads into the underlying bone. Articular cartilage is extremely important because articular cartilage does not have any nerve flow in there, it does not have lymphatic flow to it, and it has a very limited ability to heal. So you have to think about the preservation of this and the prevention of any type of damage to that area is paramount in helping to prevent osteoarthritis. Another structure that I want to speak about is the synovial membrane. The synovial membrane is connective tissue that lines the cavities of joints, bursas, and tendon sheaths. When we speak about its function is to produce a lubricant called synovial fluid. I want to talk about the knee itself, and I want to talk about the hip itself just for a little bit because those are the main things that I want to focus on. When we speak about the knee, obviously it's a weight-bearing hinge joint. We have the femur, the tibia, the fibula, and the patella. The femur, the tibia, and the patella, the ends of those are all covered by the articular cartilage. Remember, I had mentioned the articular cartilage just a few minutes ago. The articular cartilage is devoid of any blood vessels, any lymphatic tissue, and any nerves. So you want to remember that. Also, when we speak about the hip is, obviously it's a weight-bearing joint. The femur connects into the pelvis. It is a ball and socket joint. It's spherical and it moves in all different directions. The hip has the ability to carry a workload that is much greater than our body weight. So a lot of force is put on the hip with a great deal of motion, and a lot of force is put on the knee joint. They are both weight-bearing structures, and again, they carry a tremendous amount of workload when we are doing any type of weight-bearing motion and when we are participating in sports. Several very distinct physiological changes occur when osteoarthritis is present. First of all, there is degeneration of the articular cartilage. Also, there is thickening and inflammation of the synovial membrane. Another factor that occurs is there is extra bony growth. It's called bone hypertrophy, meaning that there is greater bone growth. It is nicknamed bone spurs, and it helps to, well, it doesn't help, but it causes reduction in the joint space. Usually in the advanced stages, this destruction of joint space becomes so severe that it will cause deformity in that joint. And the deformity may be different, most likely it's going to be different from medial to lateral and from right to left. When we compare that with rheumatoid arthritis, where there is symmetrical degeneration in the joint and from side to side, but in osteoarthritis, it is not. In osteoarthritis, it is usually greater in one side, being the right side compared to the left side, or the left side may be greater than the right side, and also in the joint, it is unsymmetrical. So those are the physiological changes that occur with osteoarthritis. There are two general classifications of osteoarthritis. You have the primary and the secondary. The primary is what's called idiopathic, has a very strong hereditary component to it. It's called idiopathic because medical science has not found the cause of it yet. Now, secondary osteoarthritis, that's what I want to speak about today. That's what I've been speaking about. Osteoarthritis is also called, secondary osteoarthritis is also called post-traumatic osteoarthritis. It is a late onset disorder that occurs following an injury, any type of trauma. Could be a fracture, could be a dislocation, could be a repetitive type of a trauma, and it is the body's response over time trying to protect itself and trying to heal itself that causes the osteoarthritis. So the body is working hard to stabilize the joint after an injury, and it is beginning to cause these changes that become degenerative. So you want to make sure that you do everything you can to prevent osteoarthritis. Like I said, it has a very high prevalence, especially among athletes. Secondary osteoarthritis is extremely high among athletes, especially in weight-bearing activities. The symptoms of osteoarthritis, the most common symptoms of osteoarthritis, are pain, a deep-seated, dull, achy, stiffness, pain. Also joint stiffness, limited motion in the joint, and swelling. Now these symptoms, they are a direct result of the physiological changes that I just spoke about. These symptoms are usually worse in the morning, and they are usually aggravated when the weather is cold or damp. I'll have patients that come into the office and they'll say to me, Doc, I tell you what, it's going to rain tomorrow, or it's going to rain in a couple days because my knee's starting to hurt. Whenever it starts to rain, whenever it starts getting cold, I start to feel pain in my knee a day or two beforehand. So that the humidity, the dampness, and the cold will make this condition worse. Also, this is a condition that has an insidious onset. It is very slow and very progressive with the symptoms. So the symptoms will come on gradually, and then they will progressively get worse in frequency and in intensity. Now, when we speak about the knee is the most common area that osteoarthritis occurs. Many times people who have osteoarthritis will say that the knee feels like it's locked up, and they need to get it unlocked. There will be limited ability to perform activities such as squatting, any type of weight-bearing activity where they're kneeling, they may be lunging. Those are limited when there is knee osteoarthritis. When we talk about the hip, it's the same type of thing. There may be swelling in the joint. There's going to be that deep-seated motion in the joint, the patient may have a tough time sitting for a long time. They may have a tough time getting out of a chair or getting into a chair. When we talk about motions, there'll be a tough time squatting, there'll be a tough time moving into and out of a seated position. There'll be a tough time getting in and out of the car. There will also be an aggravation of these symptoms when they are doing any type of weight-bearing activity with the hip and with the knee. Say they're trying to go up steps, they're trying to go down steps. Those types of conditions those types of activities can aggravate osteoarthritis in the knee and in the hip. The symptoms of osteoarthritis, again, the very basic ones are deep-seated, dull, achy stiffness inside the joint. Also swelling in the joint stiffness, and limited motion. When we talk about the contributing factors or the intrinsic and the extrinsic sources of osteoarthritis, there are many. This is a complex condition. There's multiple factors that are involved. It's a chronic condition, like I spoke about. It's progressive. Okay, several things happen inside the joint. Inflammation is one of the body's responses to injury, irritation, or infection. Now, inflammation, it's great. We all need inflammation, right, to keep us alive. But when there's inflammation in the joint, in the synovial fluid, in the articular cartilage, low-level inflammation that is there for a long time, that can lead to damage to those structures. And it can lead to that deterioration of those areas, which can lead to the instability and to eventually symptoms. Also, there can be a decrease in the amount of blood flow to the end of the joints. So that's something we want to think about when we are talking about our nutrition and our supplementation to help to prevent and help to manage osteoarthritis. So there's multiple things that can occur inside a joint. Like I said, that low level of inflammation is one of several things that can lead to this condition. Now also the extrinsic factors, like I said, a prior injury. It could be a trauma, it could be a repetitive trauma. It could be from an increased workload where we're just using that muscle and that joint the same way over and over again for years. So you have to think about that when you are developing your exercise plan. You want to make sure that you cross-train, that you do several different types of exercises so you are not taxing the joint in the same way over and over again. Several other factors that contribute to osteoarthritis. Increased body mass. If you are overweight, you have a higher risk of getting osteoarthritis in a weight-bearing joint. So therefore, you want to exercise, you want to have proper nutrition, proper supplementation to help you to get down to a good body weight. Another factor is a misalignment in the lower limb. And what I mean by that is if something down in the foot or the ankle isn't quite working right, that's going to put an additional workload on the knees and on the hips. So you want to make sure that you have good healthy feet, good healthy lower limb, lower leg, the knees, the hips, that everything is functioning the way that it should. As a doctor of chiropractic, I help to restore proper motion to the skeleton, to the spine, and to each of the extremities. So that's something that you want to think about to help to prevent this condition. Another thing that I wanted to mention that I didn't say before is that usually when someone has knee osteoarthritis, that will contribute to them getting hip and lumbar spine osteoarthritis. Because if the knee is not functioning properly, it cannot carry its normal workload, it's going to put an additional workload on the hips and on the spine. So there may be a greater risk if someone has osteoarthritis in the knee, there is going to be a greater risk that they are also going to get osteoarthritis in the hip and in the lumbar spine. All right, now it's time for the fun stuff. I've been talking a lot about anatomy, physiology, been talking about the symptoms, the contributing factor, and I want to educate people on this condition. That's why I did all of that. Okay, I want everyone to understand how the body works and why this condition occurs. Now what we want to talk about is the more, I don't want to say more important, but the more fun stuff, the things that we can do to help ourselves to prevent this condition. First of all, we want to exercise, we want to move, you want to keep the joints healthy. You want to do everything that you can with exercise and with nutrition to give your body the tools that it can to recover from whatever activities that you are doing. I mentioned before, don't overtax the joint. Don't do the same type of exercise over and over and over again. You want to do running one day, weightlifting another day, Tai Chi, swimming, all those different things. When you formulate your plan, your training plan, you want to cross-train. You want to target those muscles and those joints from different angles as much as you can. You also want to have built-in recovery days in your training plan. As we age, the body does not have the ability to recover and recuperate like it did when we were younger. So you want to make sure that you give your body ample rest and ample time in between training sessions and competitions to recover properly. That is so important. My personal opinion is that rest and recovery is the most neglected part of any type of fitness routine. So when you formulate your fitness plan, make sure that you include plenty of active rest days. Days where you are getting your chiropractic care, where you're getting your massage, it could be reflexology, where you're doing your stretching, where you're doing your foam rolling, where you are doing any type of activity that is going to help you to recover. Also, there are plenty of exercises that you can do that do not have the weight-bearing stress, say like running does. You can do exercises like swimming, get in the pool. You can do Tai Chi, fantastic exercise. You can get on the bike. Riding the bike is only partial weight bearing. Do exercises like Pilates, do exercises like yoga that are going to help you to strengthen your core, that are going to help you to strengthen the muscles in a symmetrical fashion. So that's going to help a great deal. You want to train hard, but you want to train smart. I know I said this several times. You want to formulate your plan so that you have cross-training, so that you're targeting the joints in different ways, and that you give yourself plenty of rest between your training sessions. If symptoms of osteoarthritis should occur, or you notice that you have osteoarthritis, or you think that you're getting osteoarthritis, you need to do several things. First of all, you need to set realistic goals. You can still exercise. You want to keep moving. You want to keep moving. Motion is the best medicine, but you want to modify your training. When I talk about setting realistic goals, what we want to do is we want to prevent further progression, and we want to make sure that you're making the most of your current situation. You want to increase the motion, increase stability, so this condition does not prevent you from doing your exercises, from doing your daily activities, and does not put you in dangerous situations. If you have osteoarthritis, like I said, you want to modify your training. I've already talked about that, so I'm not going to get into too much detail, but you want to make sure that you are doing more things that are allowing you to work on your balance, to work on your strength. You can do more body weight exercises, and you also, I know I've said this several times, you want to make sure that you are not overtaxing the joints in the identical fashion over and over again. So you want to do a variety of exercises. You also want to make sure that you're wearing good footwear. Wear a shoe that gives you the support that you need and that fits properly. You also want to make sure that you use proper ergonomics throughout everything that you're doing. not only when you're working at the computer, that's when we always think of ergonomics, but when you're exercising. So think of good body position. Keep your spine in line. Keep your pelvis in line. Do exercises that are going to help to create balance in the strength from side to side, and that are going to help you to keep the pelvis level and keep the spine straight. Do exercises, range of motion exercises for the knees and for the hips. Do balance exercises. You could use an unstable surface like a Bosu ball. That's going to help you a great deal to improve your proprioception, which is your body's awareness of where it's at in nature, and also to add strength to the muscles and the ligaments and the joints. Also, you want to look at your nutrition. I always tell people, keep a nutritional journal, because you're going to get so much information as to any foods that may trigger pain, that may increase inflammation, and also any foods that are going to help you to feel better. If you eat a certain food and afterwards your knee hurts or your hip hurts or something feels inflamed, then you want to take that food out of your nutritional strategies, because that has caused inflammation, that is causing pain. So you want to keep the nutritional journal, and that's going to give you a great deal of information. Also, you want to look at certain foods, right? You want to make sure that you're eating your healthy fats. You want to decrease your sugar intake. You want to eat lean proteins. Now, those are the very basic things that you want to do, but oftentimes it is overlooked. Those things are overlooked, and you want to make sure that you eat your lean proteins, eat your healthy fats, and lessen the amount or eliminate the amount of simple sugars that you're taking in. So you want to look at certain supplements. Vitamin D is going to help you a great deal. Vitamin K, vitamin A, certain things like Boswellia. Boswellia is great for the joints. It can help a great deal in joint health. So there are many things that you can do, not only to prevent this condition, but if you have the symptoms, that will help you to manage this and still allow you to do the activities that you want to do. Because you don't just want to sit down and do nothing. You have to keep moving. You have to keep your heart strong and your lungs strong, keep your legs strong and your spine strong. Motion is the best medicine. I said that before, and I'll say it again, and I'll probably say it as many times as I need to so people understand that. You want to keep exercising. You just have to modify your training. In conclusion, first of all, I want to start by saying thank you for viewing today's episode of Dr. Ozello Sports Medicine Report. Feel free to like this video. Please feel free to leave any feedback, comments, or questions in the comments section below. Also, osteoarthritis is a chapter in my book. My book is titled Running, Maximize Performance and Minimize Injuries. Osteoarthritis of the hip and the knee is chapter 9, page 55. You will get some in-depth information on that condition. Osteoarthritis, it's a serious condition, and almost all of us who are athletes are going to get it at some point in our athletic career. You want to elongate your running career, your athletic career, whatever events that you like to do as much as you can. Keep the joints as healthy as possible. Do everything in your power to prevent osteoarthritis, and do everything that you possibly can, if symptoms should occur, to prevent progression and to manage these conditions as well as you can. This is a serious condition. It's debilitating, but it is also a condition where you can do many things to prevent it, and you can do many things to manage it. You want to make sure that you train hard and that you train smart and that you stay injury-free so you can accomplish your goals. This is Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Thank you for viewing today's episode.